Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well, good morning. Good morning.
Oh, Dr. Mencia, it's always such a nice thing to have you here with us, and especially after Seniors Helping Seniors, because
that was a good program.
He did talk about you, actually. He said that most doctors, when they tell patients things, they don't really know that the patient's listening or even understands, and I know you're not like that.
No, absolutely.
And let's say someone doesn't...
Just this week, I had mother and daughter that came to see me, for a regular follow-up. And I didn't even bring it up. The daughter brought it up and said, Dr. Mencia, the best thing you have done for me was to hook her up with Senior Helping Seniors. Because she was saying before that program, I always felt guilty. I had that guilty feeling that I have to choose between my nuclear family and my mom, my job and my mom. And now with Senior Helping Senior, it sort of take that load away from me because they are able to take her out, take her to the movie, do things with her that I'm not able to do. And, that was rewarding to be able to hear that from a third party, a family member, not directly from the patient. But.
Dr. Mencia, that's the big plight of the boomers and the family members. They feel guilty.
Absolutely.
I have a friend whose mother calls her at least 6 times a day. She calls her 6 times a day, and this woman loves her mother, and she's in a real estate business. And I'll say, "What do you want to do?" I can't. I have to go see my mother. I can't. I have to go get her the groceries. Oh, I didn't see her. Oh, she has a cold. It's really a wonderful thing to think that you could have a company. They don't. When you think about it. As he said, maybe you need a couple of times a week, if it's not a serious situation, just for the comfort.
The comfort and the companionship, so you are not alone.
Well, one thing that that happened to me, I went to Dr. Mencia. I had my flu shot. Yay! I had my flu shot. And with no problems. I'd never felt anything. It was over, and nothing else happened. Except I felt more romantic. I don't know what. It must have been love bugs you put in me, right?
We gave you the right combination.
Right combination. But while I was there, I met a woman who was leaving. You were hugging her and saying goodbye. And she looked at me and she said, "Do you know how wonderful Dr. Mencia is?" And I said, "Yes." And she said, "Well, did you know that I had cancer with 4 months to live?" And I looked at her and I thought, "Is that just happening?" And then she said, "And that was 10 years ago." And I was mesmerized. So why don't you tell the story?
Yeah, and they wrote her up in an article. She was given 4 months to live with breast cancer. And she came to me and she said, you're just my last resort. I don't know what to do. This is what they said. And I asked her, well, do you want to fight? I love fighting. I do taekwondo, so I'm a fighter. I said, if you want to fight, be part of my team. Let's put a team together, and I promise you that whatever the best of the specialty that I need to help you fight this thing, I will find it, and I will make it part of my team. And she said, okay, let's do it. I said, well, one condition. You are part of the team. You're not sitting back to see what's going to happen. You have to be part of the team. You have to promise me that you are not throwing the towel. And she said, but there's nothing else I can do. I said, heck yeah, there's a lot you can do. So I tried to explain to her that when you become depressed, for example, somebody tell you have 4 months to live, of course you're going to become depressed. It's natural. When you become depressed, I explained to her, your immune system will drop. When you cry, your immune system drops. When you laugh, your immune system go up. When you are happy, your immune system go up. When you get up with smile and you get up to fight, your immune system is boosted by doing that. So that's your part. I need your immune system because, 4 months can become 1 month. But if your immune system is up and I need 6 months to get the whole thing together, then, you're helping me. She goes, okay, dear. And she said, I really believe in you. I trust you. And, of course, I got my office staff to move quick on this. And we got an excellent team: chemotherapy, radiation, gynecologist, surgeon. We have the whole team put together. And we set up all the appointment. So it was bam, 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 one right after the other one. And we got her in, we got the surgery done, then we follow with the chemo and radiation. And she still see she doesn't need to see the surgeon anymore, but the key person, the oncologist, myself, and then whatever other consultant, gynecologist, we still have that going on, and it's going over 10 years now. And she even moved out of town. She relocated, and she said, I relocated, but I will not look for another doctor. I will keep my address here in Fort Lauderdale so I can come and see you. And she comes every.
That's what she told me. Because we're going to get her on the radio. She's so excited. She said she will definitely come on
she will drive
the radio.
Down to come.
Yes, she was very excited. But this is phenomenal. So, and asking, this question: how does one know that you only have 4 months, 5 months, 2 months? How do they know that?
Sort of predict. You predict. If you have if cancer that, and in her case, it was the wrong prediction. It's like the weatherman can predict the wrong weather, right? It was the wrong prediction because they did a CAT scan of the chest, which, makes sense. And it showed that the lymph node in the axilla on the side of the breast were inflamed. So most likely, you have to say most likely, that have to be cancer. They wanted to do a biopsy to prove it. I say no biopsy. Because every time you stick a needle, you're spreading the cancer to the tissue that are not being affected. I said no biopsy. So I got her to do a PET scan, a total body PET scan. And when you do the total body PET scan, you're looking at metabolism from your head all the way down to your feet. Total body metabolism. And then it showed you on the breast that was being affected, there was high metabolism because there's cancer there. The axilla, there was high metabolism, but the rest of the body was clean. So I say, no, you don't have 4 months to live. We have 2 months to get that surgery done, maybe 2 weeks to get the surgery done ASAP. But no, you don't have 4 months to live. You don't have cancer in your in your brain or your neck or the middle of your chest. It's nowhere but your breast and your axilla. So there's no guarantee that I'm right, but from what we see, we have a fighting chance, and we have to move on this quick. So we got the whole team together. The most important person at this point was the surgeon, of course. So, I called my good friend that I've been working with him for over 20 years, Dr. Harrison, and I told him this is a very important case. I don't want to lose this case. I want to fight it. So he said, "Oh, Andy, don't worry about it. We'll put it on the schedule. We get it done." I said, "I'm working the clearance already." I'm telling you, this patient is clear, ready to go. So he went and we got her on the schedule and we got things done. Then, her chemo, radiation, blah, blah, blah. But it's been over 10 years, we're still fighting.
When you say you're still fighting, so...
Well, we're still on surveillance. We cannot drop we cannot drop the guard of keeping surveillance. And I think the take-home message is that if we're going to do preventive medicine, you have to be proactive. It's your body. And, When you go to your doctor is human, and they have a life, and they have worries, and they have, personal situation going on. And, if you don't make emphasis that, hey, I have this little lump in my breast, and I'm concerned, the doctor might overlook because he wasn't thinking about it. And then when you come back, oh, wait a second, didn't you have that lump? Let's, so, you need to be proactive. You need to be involved. You need to do your own research on what's going on, with your body and with your life, and be part of your team. Don't your doctor and the nurses, and it's not separate from you. Otherwise, you are at the wrong office. They should be part of you.
Right, and you've said that so often, and it's unfortunately a lot of doctors don't take the time. They probably have the time, or it's not there. The words modus operandi, they just don't think in that term, but you do, and I love it. You've always talked about the team approach, and that's why you've built your business, your profession this way. I want to make sure that everyone knows we're here live with Dr. Andy Mencia. I'm Anita Finley, and you're listening to the Boomer Time Show. And Dr. Mencia, you can reach him at his office. He's open on Saturdays, if you want to believe that. Get your flu shots.
Both offices are open.
Both offices are open. Okay, you've got them really trained now. I can see that. Get your flu shots at either office. The number in Fort Lauderdale to call is 954-489-1345. The office in Boynton Beach is 561-270-6494. I know that a lot of times you can't get those numbers right, so this is their website. If you go to their website, it will show you both offices, and that's AGI, standing for Adult Geriatric Institute, AGIFL for Florida, AGIFL.com. And you can get so many things done. The one thing that, of course, we've told you about is they have a major dental department,
with all
beautiful
the specialists
dental,
and all of that.
Yes,
it's really
beautiful.
very complete.
We've had the periodontist on our show. We've had,
orthodontist.
Yes, we've had people who are so skilled, and you do want to go there. But something we don't talk much about, you have dietitians and nutritionists, and they are both beautiful and kind and smart.
And smart.
And Smart for Life just told me that you really are doing big things with Smart for Life.
We are working.
And the laser, yes, they told me and they said, I should tell you, should talk about that.
Courtney is gung-ho with the lasers. Yeah.
And she's wonderful.
She's the
Courtney
the laser queen.
Well, she's an amazing woman.
She is an amazing woman.
But she does the whole
and
thing.
And she loves her profession. That's why I love her so much. When you get somebody that joins your team and you see that they love what they do, it's so beautiful. And I always talk to my nurses and my staff and say, if you don't love what you do, you are in the wrong office. I don't want you here. I don't need you here. We can still be friends.
I understand.
But I want people here that they really love what they do.
It's like you.
I love it. I mean, I get up early in the morning. I'm the first one at the office. I just love being there.
I know.
And
that's why people love you, because you care about everybody. I mean, he hugs men, he hugs women, he hugs dogs.
Yeah.
I mean, he just loves life.
Walk around with your dogs.
You just love life, and that's what's so great about you. But getting back to this nutrition, and we don't talk too much about that, if someone really wants to stop smoking and they want to lose weight and they want to get rid of some of the addictions, just like some of people have prescription medication, that's becoming a very big deal with addiction. And doctors have a big responsibility that I don't think they've taken seriously.
Absolutely. And, there was a special on 60 Minutes on very young people, high school and junior high school, and freshmen in college, where they are starting their addiction and then going into street drugs before they even go into to finish college. So we are losing a lot of young life, and due to addiction, and I tell my patient, even when they want to quit smoking, one of the main reasons people fall back into the nicotine use and abuse, especially women, is because once you quit smoking, you start gaining weight. And the patient don't like for them to start getting obese. So the moment they quit, they start gaining weight. So when my patient want to quit, if it's nothing immediately that they are thinking about it, I say, well, why don't you see my dietitian? And they go, what do I have to do with
Very good.
we stop smoking?
Very
I say,
good.
because if you see my dietitian, when you decide that we're going to quit smoking, then you won't gain weight. We're going to keep your weight checkmate. And those that have tried in the past, they say, oh, that's a great idea. I never thought that way. So they start with the dietitian. We start a intense regimen. And then if they're going to see the hypnotherapy or whatever method they want to use to quit smoking, or they just want to stop cold turkey if they are strong enough mentally, then we quit smoking and we move on. And notice that I say we.
The same team approach, right?
Absolutely. It's not you quit and you fell back. No, we fell back and we are. And I tell them, from time to time, you might pull out a cigarette. Just be honest with me. Talk to me. And I'm not there to judge my patient, to get mad at them, to scream at them. I'm there to understand them. I say, do you still want to, try? Because I'm here to help you.
Well, I'd like to move this a little bit further then also with drugs. I mean, with actual medication. So let's say someone comes in and they've just had a fall, or let's talk about people in their 40s, 50s, whatever age. And you, of course, give them prescription medication to ease their pain. Mm-hmm. But as a doctor, when do you know to say, stop, we don't want you to do this anymore? Because that seems to be the problem.
Well, when the patient come to you and let's say they have a fall, the first thing to do is to assess the level of pain from 0 to 10. 10 is like completely normal. I never had a fall and I have no pain. And then 1 is like that little ache that you get in your back sometime when you've been sitting in a position for a long, long time. And 10 will be like the most horrible pain that you can hardly tolerate. It's excruciating pain, and it's so bad that you want to. The pain is so bad that you just you will prefer to be put into a coma so you can sort of relax and let it go. So when a person is at a level of pain, let's say a 7, something like that, after several extraction or they go to the dentist, they have 3 or 4 extraction, and then they will be in some pain. And so usually we set up a scale for the patient, and then we set up options. So we give, let's say, ibuprofen. Yesterday, one of the dentists consulted with me. We had a patient that is diabetic, 89 years old, have several extraction and implant done on the same day. So they asked me, what should I give my patient for pain? Should I go with a strong Percocet, intermediate? I said, well, I gave the scale to the dentist, give this to the patient. If the pain is between 1 and 5, you're going to take ibuprofen. She says, I already wrote the ibuprofen, 800 milligrams. I say, no, that's too strong. You say he is 89 and he's a diabetic. You're going to mess up the kidneys. Drop the ibuprofen to 600, and she had 800 3 times a day. I said, no, 600 twice a day, no more than twice a day. And then the Percocet, we gave intermediate dose, 325. And then the quantity of Percocet, we get 15 tablets, and the quantity of ibuprofen, we get 20 tablets. And that sort of helped the patient. Okay, this is for me to use rarely, and this is for me to use as needed for the pain of the first 24 to 48 hours. And once then educating the person, once the inflammation start going down, the tissue will try to come together and heal And the healing process that you feel, that pulsation and pulling that you feel, that is not pain. That's just the process of the tissue trying to come back together. And it's not, you don't need painkiller for that. And once the patient understands that, the patient had been educated, they don't, they won't be chasing the pills. They're going to be understanding their process more than anything. And those patients are very unlikely to become addicted. The one that do become addicted is the one that they get a bottle of 90 tablets of strong painkiller, and they are very loyal to the doctor. Whatever the doctor, he or she say, they will do. So if the doctor say take one tablet every 4 to 6 or 4 to 8 or 6 to 8 hours, when they see as needed, they don't understand what that means. So God forbid you write that prescription and you don't put as needed, and you have that type of patient that will do whatever you say just to be loyal and faithful to the doctor. And you will be taking a medication that eventually then your body say, give me more. I want it, And they get euphoria and they feel good, and they continue to take it. They want to continue to take it. And, I never taken painkiller. And I had a car accident that I was hit. So they sent me from the hospital with a neck support and some Percocet. It was a low dose. It wasn't even 5-325. It was a very low dose. So I said, in order for me to go to work, maybe let me try one. I took one at night to go to sleep, and I slept. And I said, let me try one to go to work. And my patient kept telling me, are you okay? I said, no, I had a car accident. No, we know that, but you look like a zombie. We are talking to you, and you are not processing. I said, wow. And I felt like a zombie. I felt like I was in a tunnel. I said, I'm not doing this. Thank God that I have a doctor in acupuncture in the practice. One of my physicians that had been with me for 15 years, Dr. Pham, who is also a geriatrician and an internist. His sister is a doctor in acupuncture. So I say, okay, you're going to treat my pain. I don't want any painkiller. I wouldn't even take Tylenol. I don't want anything.
That's a very good point. Doc, I want to ask you a question about that. I've been, usually it's only if I have gone to a dentist and I've had some major surgery. They always give me the 800 the ibuprofen, and then they give me the pain pills, and I don't take things. I never take them, and I always feel it's better to be in a little pain and not take them. Now, am I wrong? What happens when your body's in pain? That's not so good either, right?
No, depends. I remember when I did my rotation in surgery.
Almost finished. I can't believe this.
I remember when I did my rotation in surgery, and me as a young doctor doing my rotation in surgery, I see a patient that came in with questionable appendicitis. So I told the professor, I said, maybe we should give some painkiller. I feel bad. It was a young girl. I feel bad for her. I started identifying with my patient. I said, I feel bad for her. Maybe we should give some painkiller. And he said, hell no, man. We need that pain because that's going to tell us if we have to rush her into surgery or we still have time to buy it. So pain is not bad. It's a good indicator when things are getting better. Sometimes you have an extraction or you have a needle put in your one of your joint to treat arthritis or anything like that. If you take painkiller and you start having a bleed inside the joint, you won't know anything because you have no sensation. But if you are able to perceive, you have the sensation, then you know that, hey, before they put a needle, my pain was 3, and now it's a 9. Something is not right.
Dr. Mencia, what's not right is we never have enough time.
No.
That's what's not right. AGI Medical and Dental Centers, home visits are available. Go meet Dr. Mencia, go down to Commercial
Go and drink
Boulevard.
some water so I can lock the door, and then I stay here for another half an hour.
Right, 954-489-1345. I know you enjoy his shows as much as I do. I sit here mesmerized. The number in Boynton is 561-270-6494. We'll be right back. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.